Okay, this is Dr. Jerry Como. We're back with our case from Rhode Island. It's a Straumann case that had prior access by a previous dentist. The little struggle came in. Let me show you where the struggle is. Patient's here now with this part of the temporary abutment is now missing. This is the implant body itself, the screw itself, and let me just lower this a little bit. Okay, so now here's your implant screw, access hole, your crown. Okay, we took an alginate, and so this is all off at the gum line. This temporary now has been bonded to an adjacent tooth. So I'm going to make an access hole through that. Look around in here for color change first. It is canted to the distal a little bit, so the path will be slightly distal until we reach the head of the screw, which we hope to identify, as a Straumann star type of screw here. Once we do that, we'll inspect the threads or the top of the screw, and then down, hopefully be able to turn that screw. It's been in with 35 Newton centimeters of pressure, of torque, I should say. So I'm just going to turn my suction on now, and we are going to go ahead with gaining access. So again, it's going to be slightly distal, slightly distal. Here we go. Now, usually if we're angled in on an implant and there's an angled abutment, we're going to have to come in almost from the incisal edge position. So I'm going to cut a nice trough as if I were doing a root canal. Again, we're going to go a little slightly to the distal axis. And zoom in. And I'm going to come lingual. The key to any of this is to try to gain access that straight line to the screw head. And to have good visual. You have to have a microscope. You've got to be able to see what you're doing. Okay, a little squirt down in there. Okay, we'll dry it. Alright, I'm just going to sweep down in here. We'll get some of this. Alright, back up in here. Here we go. Alright. So far nothing. Still in the plastic. As you can see, we're still in the plastic. Now I'm looking from the lingual aspect of number 10. It's a Straumann RC. Now we know this is bonded to the adjacent tooth. I can just go right in and make a nice access hole. It's like a bis fill. Some kind of a bis GMA. And suction again. And suction close. Okay, now it's starting to show a little darkness, so here we go. Okay. There we go. And we'll open this up a little bit more. More than likely lateral incisors, probably to the lingual a little bit, I would think. Considering this, only thing we have is an X-ray is two-dimensional. All you got to do is identify the top. We'll dry that. Sorry. Out. Turn it off. Just double checking that. Okay. Come in a little bit more. Now we've taken an alginate, but we won't pour that alginate because what we want to do is, if we do have to take the crown off, I'm just trying to save her some cost. If I can get to the screw, tissue please, on the chest, please. Thank you. I'm drying. Now I don't know what's in the way, so I'm going easy here. Stay out, please. There we go. Now we're in. Here we go. Turn it on, please. Okay, there's our access. Now we don't know what that is, so let's use an endodontic explorer. Out, please. Turn it off, please. Air in the mirror. So there's something in there, some protection. Something was injected in there. I don't know what that is. That's fine, thank you. So there's stuff in there. I got to find out what that is. Some kind of a material. It looks like some kind of a composite material. That's what it is. So as we were discussing, you know, we're a little more to the distal on this. So I'm breaking through that composite material to gain access. Suction lingual. So it's just stay a little bit out of the line of sight, please. That's it. So now there's a piece in there that's mobile, it's moving around. That might be a plug used by the surgeon or a plug used by the general dentist. So we got to get through to that. So I'm going to open this up a little bit more. I'm not going to go vertical through there, but I'm just going to open it up. Okay, I'm going to just do this without water. So let's see, sorry about that. You lost me. I'm back. Out, please. Air ready. So I'm widening the access hole and I'm giving myself enough visual acuity to understand what's going on. Okay, let's take a close look. Off, please. Let's turn that off. Okay, so this is kind of like a little rubber material. It's not even Teflon. It's some kind of a wax, if you will. Maybe not even a wax. Wax would be a lot easier to remove. So we're not quite ready for microsuction yet. I'm going to open up the access hole a little bit more. Now, I'm not going vertical. I'm just going air in the mirror. Okay. See how I did that? And now come lingual. Okay, so now my timer's telling me we're right about 10 minutes, so I'm going to stop at this point, and I'm going to come back, and we'll find out what that is. I'll get it out of there. This is Dr. Jerry Como. We're on a rescue mission for Strawman here. Hopefully the sun will be shining today. Thank you.